America's healthcare advocate, Carrie Hall.
Hello, America. Welcome to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIA Radio Network. All right, in today's show, this is our fourth in the series from the folks at CenterWell. I want to welcome Sarah Dahl. She is a nurse practitioner of the show. Welcome.
Hi, good morning. Thank you for having me.
Thank you for coming up. So let me a little bit about Sarah. We're going to be talking today, as usual, about the CenterWell model and what they do, but we're also going to be talking a lot about medications today. Now, why is that important? Because as a seasoned citizen, we take a lot of medications, okay? I think I take 3 now, okay? So seniors typically take, a fairly decent amount of meds. And then the question is, how are you managing that? What are you doing with that? And we're going to talk about all that today and why is that important. We're going to talk about a thing called medication adherence. Why is that important? Why is it important if you happen to be in the sandwich generation? That's your mom who's 86 years old or your dad who's 91, and how are you tracking their med use and what they're doing? And what are the consequences if they're not doing what they should be doing? So we're going to talk about that today and just generally a lot about CenterWell. Sarah is a certified nurse practitioner. She has worked in healthcare field for over 10 years, first as a nurse and later as a nurse practitioner. Before coming to CenterWell Senior Primary Care, Sarah worked at Centerpoint Medical Center. She also worked at St. Luke's East, and she worked at Research Medical Center. Sarah's specialty is family medicine, completing her studies at Rockhurst University. In her bio, there's an interesting piece in here. She said she believes that mutual respect and trust are fundamental to the best provider-patient relationships. I saw that this morning and I highlighted that and I thought, you know what? That speaks volumes about you.
Well, it's really true. It's impossible to have a trusting relationship if you don't trust each other. And I think when it comes to taking medications, adhering to treatment plans, you really need to be able to trust your provider. But your provider also needs to be able to trust you and be comfortable having shared decision-making conversations when we're talking about your treatment.
But in order to get that trust, this is something I frequently bring up when we talk about CenterWell and these type of models and how they work. You probably need more than 7.5 minutes with your primary care provider, which is the average time that we get with primary care doctors across this country when we're in for visits, which is completely different than the CenterWell model. So talk a little bit about your model and how you develop that trust, because that's really critical to why the CenterWell model works so well. Sarah?
Absolutely. So this is the first company that I've ever worked for as a nurse or as a nurse practitioner that really gives you the time that you need to have the conversations that you need to have and to be as thorough as you need to be in primary care. So primary care can be pretty complex. You have to know a little bit about everything. You don't specialize in any one area. And so as a result, patients come to you for anything and everything. So you really do need that extra time to be able to sit down, have a conversation with a patient, see eye to eye on things, and come up with a treatment plan that you both agree on and that you're both comfortable with. And at CenterWell, we are given that time. In other corporations that I've worked for, I can speak to the 7.5 minutes or roundabout that you're allowed to have in a visit with a patient. So instead of, 10 or 15 or 20 minute carved out appointment times in their schedule, at CenterWell, we're given 40 minutes for every single patient that comes in. So we're really able to dig deep into questions and issues and try to come up with answers for our patients the best that we can.
And that's important. It's critical if you're going to develop a relationship with your patients. Is
Absolutely.
It not?
Absolutely it is. Absolutely it is. We get to know you as people rather than just patients that are coming in through the clinic, for this or that or just their normal checkup. Because we have the time to really have conversations with our patients, we are able to develop a more trusting relationship.
And the CenterWell model is significantly different in that you are focused on seniors. So chat about that just a little bit. So you can't take your 12-year-olds there, okay? And if you're 25, you're not going to go to CenterWell to get care. This is designed specifically for those of us, as I like to say, that are chronologically challenged. So let's just talk about that for a little bit.
So it's true. We are senior focused. We do take all Medicare patients. So some of them are not seniors, but the majority of our patients are. And that's really what our care model is based on.
And the needs of seniors are significantly different.
Yes.
And I speak from experience, thank you. Significantly done 70. I'll be 75 in May, people, so just so we know. Okay? So they're significantly different than the needs of, say, somebody your age, 30 years old. Okay. It's significantly different, yes?
Absolutely. So if you've been living, for 75 years, if you're chronologically seasoned, then sure, the body wears out over time. More problems pop up. Your needs are just totally different than somebody who is 25 years old and, requires no medication.
Which goes back to this whole focus of CenterWell on giving you the time to sit and talk to people like me who, what are your issues? Or what are the things you'd like to talk about? That you're able to do that.
Exactly. And I think something that's unique to CenterWell that I haven't seen at other primary cares is that they really give us the resources we need to help patients in a holistic way. So we're not necessarily just focused on your medications or just focused on testing or specialists. We're also looking at you as a whole. So we're worried about your social well-being, we're worried about your financial well-being, and we have resources to help you in those areas as well, because we want to take care of you as an entire person, as opposed to just, looking at your medications and keeping your blood pressure where it needs to be.
In that 7.5 minutes that you get to, here's the medication
Right, yeah.
out the door. Yeah. So, but to that point, if someone is struggling financially or they're struggling with relationships, or maybe their spouse died.
Sure.
And now they're trying to figure out, I've been married for, in my case, 40 years in November. Okay. What happens when that spouse is gone and you're by yourself, and how are you coping with that? Or you're not coping with it. So that's all part of what you are able to provide.
Yeah, and I think that's really unique to our care model here. Most primary cares just can't offer that.
No, it's extremely different than your primary care model.
Yeah.
That's one of the reasons why I think it's as successful as it is, and you've had such great success with it, and will continue to have great success with it. When we come back from the break, we're going to continue this conversation with Sarah Dahl. She is a primary care provider at CenterWell. She is a nurse practitioner, and we're happy to have her on here today. And we're talking about all things relating to those of us that, as she called us, chronologically seasoned. She just coined a new term.
Oh, did I? I thought that was your term.
No, I'm going to steal that term. She put them together, so I'm going to steal that
I'm
term
sorry.
for the show. If you want to know more about CenterWell, SeniorFocusKansasCity.com. SeniorFocusKansasCity.com is the website, and the phone number is 816-640-8522, 816-640-8522. We are on, we think, 234 affiliates. Am I counting these right, Dave? I think I am. So here's the newest one. KRFE AM and FM 95.9 in Lubbock, Texas. This is our third affiliate in the last 2 months in Texas. So we appreciate all of you in Texas and want to welcome KRFE to the America's Healthcare Advocate family. We want to thank Anthony Garza. He is the program director that put us on. We're very happy to be on Lubbock. If you need help with Medicare, you're chronologically challenged, and you're looking for Medicare coverage, you can give Carol Lee Steele a call. She is a certified Medicare expert. She's at RPS Benefits by Design. The number is 877-385-2224. Also, if you're looking for ACA coverage, Obamacare, whatever you call it, individual health insurance, maybe you're losing your group coverage, she can also help you with that. And speaking of group coverage, if you are an employer and you're having problems with your health insurance, cost is going up, you can't keep it under control, employees aren't happy, give Maria Alders a call over at RPS Benefits by Design. Same number, 877-385-2224. She is happy to help you. She is also an expert and can help you anywhere in the country if you are struggling with the cost of health insurance. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIU Radio Network, coast to coast across the USA.
The Golden Rule. Treat others as you want to be treated. I'm Steve Keeker, and this is one of the founding principles of my firm, Senior Care Consulting. Since 2002, our value statement has included honor our mother and father, respect our elders, care for those in need, and treat your family as our own. We've been honored to help hundreds of families make one of the most difficult decisions they could ever make, serving them in their greatest time of need. If you're looking for someone who can provide you experienced and objective guidance when searching for a senior care community, reach out today and discover the services of Senior Care Consulting at 913-945-2800, 913-945-2800. Know your options and choose with care at seniorcareconsulting.com.
Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HIE Radio Network. So in studio with me is Sarah Dahl. She is a nurse practitioner for CenterWell. It is a primary care model focused primarily on senior citizens, and that's what we're talking about today. So locations here in the KC Metro?
We have 7 clinics in total right now. We just opened a new one within the last year. So we've got 2 on the Kansas side. So for our national listeners, Kansas City is kind of on the border between Missouri and Kansas. So
right.
We are on both sides of the state line to serve our patients, both in Kansas and Missouri. So we've got 2 locations in Kansas and then 5 scattered around on the Missouri side.
And by the way, since Sarah mentioned national, if you're listening to this, you're outside of Kansas City, you're in Nebraska, you're in Kansas, you're in Lubbock, Texas, there are CenterWell models around the country. So you can go to the CenterWell website and see if there's one in your particular community, or if you're looking for access to one, you can go to the CenterWell website and do that. The website here is seniorfocuskansascity.com, seniorfocuskansascity.com. The phone number, by the way, 816-640-8522. If you want to go take a tour, hey, maybe you're a caregiver or you're in the sandwich generation and you've got an aging parent or grandparent. You want to see if this might be a good model for them. Go over there and take a look at it. Give them a call. They're happy to have you come by. You can see what they do and how they do it, and meet Sarah or somebody like Dr. Akime or some of the other doctors that we've had on this broadcast. So once again, the phone number 816-640-8522. All right. So why don't you define medication adherence, okay? Because that's kind of one of the things we're going to talk about in a little detail today.
Put simply, is a patient's ability to take medication as prescribed. So that can be anything from taking it at the correct time of day, taking the correct dosage, taking it as frequently as it is prescribed, but also taking it for the length of time that it's prescribed. So in short, medication adherence is the patient actually taking the medication as recommended and prescribed by their medical provider?
So let's talk about length of time.
Sure.
Because I'm bad about this. Okay. So you get an antibiotic. You've got a particular illness issue, and the doctor gives you a prescribes an antibiotic. You get halfway through, hey, I'm feeling great. I don't need to keep taking this stuff. I can put it down now. I don't want to take this anymore. I'm fine. And then, unfortunately, if you do that, sometimes what happens is it rebounds on you, and you're right back where you were starting. Talk about why that happens, why that's important. And I'm guilty of doing this. I don't do it anymore, but I used to do it all the time. Talk about why that's important.
So for antibiotics in particular, yes, it's important to finish the entire course as it's prescribed. As you mentioned, if you don't take the entire course, you're right. You may not completely kill the bacteria and the infection can come back. But also we are facing a problem in the medical community where superbugs are developing, meaning bacteria that are resistant to a lot of the antibiotics that we have. And we haven't come out with new antibiotics in quite a while. So it's important to completely kill the bacteria that's causing your infection so that these bacteria do not continue to mutate and become resistant to the antibiotics we have available on the market.
What is a superbug? It's not an insect in the house. What is a superbug, Sarah?
So it's a bacteria that is resistant to most of the antibiotics that we have available, meaning the antibiotics available that we would normally use to treat a particular type of infection don't work on those bacteria. So when you're finishing your antibiotics, you're taking care of yourself, but you're also helping the community as a whole because we're trying to control the mutation of our bacteria.
So that's very interesting. So it is important to continue taking them and don't do what I used to do it, not anymore.
Take the whole bottle, yeah.
Take it all. Do what they tell you to do. There's a reason for that. Following those directions is important. Kind of like finishing the antibiotic med is important.
Sure. Well, some medications are short term. They're treating an acute problem. But some medications are chronic, meaning you're going to be on them for a long period of time or even indefinitely. We use medications for lots of different issues. In the senior community, we see a lot of things like high blood pressure, high cholesterol, and diabetes, among other things. And, the medications that you take for those, it's important to adhere to them because what we're doing is we're preventing complications from these diseases down the road. So, for example, if you have high blood pressure, you take your medication for a week and decide you don't want to for whatever reason, and you don't let your provider know, if your blood pressure shoots through the roof, then you're at risk for something scary like a heart attack or a stroke. And the same goes with things like cholesterol medicine, diabetes. People a lot of times don't take their medications because of side effects that they don't like, or they didn't fully understand that once they're out of their bottle, they need to refill it and keep taking it. Among other reasons, there's lots of reasons why patients decide not to take their medication. But I think the key really is communicating with your provider about it. Because if you don't tell us something, then we don't necessarily know to talk to you about it in your next appointment. And I think what's important to remember is with medications, there's usually always an alternative. So if there's a reason that you're not wanting to take something, please, please, please tell your provider the reasoning for that, and then we can have a conversation and come up with a treatment plan that the patient and the provider is comfortable with.
So how does CenterWell implement that with the patient and we'll talk about this in the next segment, the caregiver or the sandwich generation child that's overseeing the care of their elder parent? How do you implement that with those different parties to make sure that's happening?
So I think the most important thing is communication between everyone. So the caregiver, the child or family member, whatever loved one is involved in the patient's care, as well as our care team at the clinic. So we have a pharmacist that we utilize that is specific to CenterWell. Then we have our nurses' aides, our medical assistants, and then there's the providers, of course. So if everyone is communicating, then that can increase, medication adherence rates. But we also do offer different things that I think a lot of primary care offices don't. For example, I work in an underserved area. I have a lot of patients who have dementia and just don't have a support system at all. And because of their memory issues, they're not really able to adhere to their medications in the way they want. So there's lots of little tips and tricks that we can implement to help them with that.
But you see, what's different here is that they focus on this. They have the time to focus on it. They have the resources to focus on it. And that is significantly different than the typical model you see in a large hospital system. We'll be right back after the break. You're listening to America's Healthcare Advocate, broadcasting here on the HIA Radio Network, coast to coast across the USA. We'll be right back. Welcome back to America's Healthcare Advocate. You're listening to us today across the country, and you're also listening to us on all of our podcast platforms. My producers, by the way, today, Mr. Sean Floyd and Mr. Dave Thiessen behind the camera. Sean Floyd here at Odyssey doing all of our audio work, and Dave Thiessen doing all of the video work that posts on all 14 of these podcast platforms, which are Amazon Music, Odyssey, Overcast, Pandora, RSS Podcast, Stitcher, Spotify, iTunes, SoundCloud, Spreaker, Rumble, Pocket Cast, Google Podcasts, Apple Podcast, and YouTube. So if it's out there, I think we're now on iHeart as well, by the way. So if it's out there, we're on it. You just need to be aware. If you want to download one of these shows, maybe this is a show you want to tell your parent about, or maybe it's a show you want to talk to your grandparent about, or maybe it's a show you want to talk to your spouse about. The way to do that is go to the podcast platform and listen to it, or go up on the YouTube platform and listen to it. They are up there, and it's a lot easier sometimes to do that than try to re-explain everything that Sarah is talking about here today. In studio with me, Sarah Dahl. She is a nurse practitioner from CenterWell and the primary care clinics that specialize in care for senior citizens. So let's go back to this for a minute and just talk about filling prescription medications, the continuation of medications, and how do you facilitate that, and why is that important, especially for seniors? Obviously, you mentioned two, blood pressure and cholesterol. I take both those.
Sure.
Yeah, and I take it religiously. But why is that important for that to be monitored and paid attention to?
Mm-hmm. Well, kind of like we went over before, if we're not managing these issues with medication, then we're looking at dangerous events down the road. And our goal always for you is to have the healthiest, happiest life that you can. So if we can prevent complications later on, then, you can potentially live longer and live healthier. But, also not adhering to medications can be really costly. I do have a statistic here that the direct cost of people not adhering to their medications in the way that they're prescribed costs the overall healthcare system up to $289 billion every single year. And patients individually, it can cost them up to $2,000 a year just paying and
deductibles, co-insurance, out-of-pocket max
exactly
on the Medicare Advantage policies, etc.
Doctor's appointments, yeah, absolutely. So not only is it costly to the country, also to individuals financially, but overall, we're trying to give you the happiest, healthiest life that we can.
Yeah, and what's interesting about that? If you wonder how could that possibly be, well, if you don't take, let's just use blood pressure. You don't take the blood pressure med. And you just quit taking it, you're at risk for stroke. Do you have any idea what it's going to cost when you get taken by an ambulance, assuming that somebody's there to recognize that you're having a stroke, that you get taken by an ambulance to a hospital where they're going to have to treat you for that stroke? Yeah.
Among other things, high blood pressure can do lots of things. I can't tell you how many patients that I have on dialysis because they're in kidney failure from uncontrolled diabetes and uncontrolled high blood pressure over the years. I have patients who are blind because of damage that's been done to their eyes by high blood pressure and uncontrolled diabetes. So it's not only, acute costs, like you were talking about, ambulance rides, hospital copays, the cost of treatment in a hospital, or then rehab afterwards. It also can cause chronic issues later on down the road that can then be costly as well.
Okay, so let's segue to this. We've talked about this off air a couple times so far. If you are a caregiver, or you're in that sandwich generation where you're not necessarily doing day-to-day care, but you're concerned about mom, or you're concerned about dad, or you're concerned about grandpa or grandma, that they're taking these meds, how do you at CenterWell interact? So the parent or the grandparent gives permission every doctor's office you go to. Is there another person you're going to allow to have this information? Yes, sure. I want my daughter to have it. Yes, I want my son to have it. How do you all interact with them, if you're given permission to do so that they know, hey, your mom's got a problem here and you need to get involved? How does that work?
Well, I do encourage loved ones to actually come to appointments with the patients if they're able to, so that we can all have a conversation together. Especially, later on in life, if you're having memory issues and that causes a barrier to your treatment adherence, then having family members and a support system on board can be helpful for that. So I do encourage loved ones to come to appointments so we can all be on the same page about what's going on. Also, I will always ask the family member in an appointment, what are your concerns today, in addition to the patient? I don't have an issue calling loved ones either. So if a patient comes to an appointment and I have some concerns, then I don't have an issue if you're listed on the patient's HIPAA form to call and communicate my concerns with your caregiver if you weren't able to be there. But we do really try to facilitate every aspect of a person to give them the best treatment possible.
That's different than typical primary care models.
Sure.
It is definitely different. My wife's got a significant heart issue. I've talked about this on the air before. And our daughter who lives here, moved here specifically because of that with her family to assist. She goes to the appointments with us. So when we go see her heart specialist, Andrea goes with us. And there's a reason for that. Okay, so that there's somebody else involved. Should I be out of town or something happens, she knows what's going on. So that's really important. The fact that you're including them and ask them, come and see what's going on here so you understand.
Sure. And there's actually studies that show if there is a second person present in the exam room, then the rates of treatment adherence are better.
That's interesting because oftentimes Andrea will ask questions that I don't think to answer,
Sure.
or Lori doesn't think to answer, and her a lot of times also, we leave the appointment. She hears things differently than we hear.
Exactly, or she remembers things you don't.
Yeah, she does. So, which brings us to memory issues.
Yep.
So now you've got a seasoned citizen that is having cognitive issues. Well, let's go back to taking the medications. If they're having memory issues, and you don't know whether they're taking the meds or not, having that other person involved, how important is that?
It's very important. I do have patients that don't have a support system. And, I think one benefit to CenterWell is we can get you in for an appointment. It's not going to be a 3-month wait, for you to come in and talk about a problem that you have. I have patients who don't have a support system, but do have, issues adhering to their medications or their treatment plans because they can't remember. So I'll have those patients come in every 1 to 2 weeks. We'll talk. I will fill pill boxes for them personally, or our pharmacist will set them up with pill packs, which is a pharmacy delivery service where they package their pills in morning, noon, and night, or however often they're supposed to take them, and mail those medications to the patient's home, which makes it a little bit easier for them than having to open, 10 different bottles at 3 different times a day and try to stay on top of what they're taking. So there's lots of different resources available, that we can give patients. And we always let patients know that we're available for them. So 24 hours a day, we have a provider on call. We always tell patients before you head to the ER, if it's the middle of the night or a weekend or a holiday, please call us first, because sometimes it's something we can handle for you. Or, if an ER visit is necessary, of course, we'll recommend that. But oftentimes we can get you in the very next day to discuss whatever the problem is.
So the fact that you actually put together the pill boxes. We have.
I do.
I don't do this. Okay, she fills them. It's the morning and the night every day. We have them, but that you actually do that, or you have a pharmacist who does the pill packages and labels the days and what morning to take, eating, whatever the case. That's a service you actually provide.
Well, not CenterWell Pharmacy in particular,
Correct.
But we do have resources where we can refer patients to mail-in pharmacies that do offer that service. I don't know that all providers will fill a pill box.
They will not.
Because they don't necessarily have the time, but I will, because I will do anything and everything I can to help a patient stay happy and healthy for as long as they can.
That's a classic example of why this is significantly different. The way that you do this and the level of care, and why that's also important when you're interacting with other family members involved. So that here's how we're going to do this so that you make sure they take them. We're going to send the pill packages, and that way when you go over there, you can see there's 7 days worth of meds here, but only 2 days have been taken. Well, there's a problem.
Exactly.
So it all comes together. It's kind of like you talked about earlier, this total care model, which is what you're really talking about, isn't it?
Well, yes. And I think a great resource we have is our internal pharmacist. So I will have patients that I'm starting them on a new diabetes medication, or they come in and this is the first time they've ever been diagnosed and they're not sure what to do. So I'll send a referral to our internal pharmacist, and she will actually reach out to the patient with phone calls in between appointments to say, did you get your medicine? Are you having any trouble taking it? Any side effects you don't like? Is it an injection that you're not sure how to administer? So we're really trying to get all hands on deck that we have to help patients in the best way that we can.
Very different model. As you can see, it's all encompassing and it works very, very differently. If you want information on the SeniorFocusKansasCity.com, SeniorFocusKansasCity.com. If that's your parent or grandparent, you probably ought to take a look at this or schedule a visit over there. 816-640-8522. 816-640-8522. Give them a call. They'll be happy to chat with you. We'll be right back after the break. You're listening to America's Healthcare Advocate. broadcasting here on the HI Radio Network, coast to coast across the USA. We've got more. Don't go anywhere. Welcome back. You're listening to America's Healthcare Advocate Show, broadcasting coast to coast across the USA here on the HI Radio Network. If you want to find out more about us, the website americashealthcareadvocate.com. My producer from the Odyssey side of the microphone, Mr. Sean Floyd, behind the cameras, doing all the video and camera work, Mr. Dave Thiessen, in studio with me, Sarah Dahl. She is a nurse practitioner at CenterWell. You can clearly hear, if you're listening to this, obviously, this is a really different model. It is directly focused on senior citizens and delivers a level of care that is not the norm, okay, which is one of the reasons why it's so successful and why they have such great retention with their patients. If you want to learn more, seniorfocuskansascity.com, seniorfocuskansascity.com, or 816-640-8522, 816-640-8522. Schedule a visit, go take a look at it, and see what you think of it. You might be surprised at what you'd learn, and you might be surprised how much you like it. All right, so a lot of times, seasoned citizens are on fixed budgets. Mm-hmm. They're not working. They're getting Social Security, maybe a pension, maybe some type of retirement fund they put together. But getting medications can be an issue. If it's a specialty med, which is not covered by Medicare, which happens. Okay, we just had a couple of meds pulled off the market because CMS chose not to cover them along with the VA. Those are related to cognitive issues. Biogen was the manufacturer of those. But let's talk about how you help them if there's a med that you think can make a difference and it's not covered and they can't afford it. Mm-hmm. How does that work?
Well, a couple of things. I mentioned our internal pharmacist earlier. She's readily available all the time. So if I have a patient who's in the office and says, I can't afford this med, I can directly message her and say, I need a cheaper alternative that's covered by their insurance. And she will get that information for me before the patient leaves the office. Another option that we have is what's called a PAP, a patient assistance program. Yep.
Right.
And that is through the drug manufacturer of the specialty medication. So if a patient is on a fixed income and they can't afford their out-of-pocket cost for a branded medication, then we have an entire department actually that will help a patient complete a patient assistance program application. And then once that's completed, the provider will sign it, and then the patient will receive that medication generally in the mail to their home, or sometimes it's mailed directly to the clinic where the patient can pick it up. Another option is low-income subsidies. So in our underserved areas, particularly where I work, if a patient is having a hard time affording medication, generic or branded, sometimes we can get them approved for low-income subsidy with their insurance, which means they pay nothing.
Wow. Mm-hmm. So again, okay, this is another example of how they do what they do that is very, very different than what you typically see in a primary care setting. So, and those programs work. The PAP program, I'm extremely familiar with that. And that basically is where the manufacturer is saying, yep, we're going to go ahead and supply this medication. It may be at no cost at all or some very, very low cost.
Often nothing, yeah.
Often nothing, because the manufacturers, they're required to provide a certain amount of assistance, and this is one of the ways they do it. So that's a pretty amazing model. Let's talk about this acronym SIMPLE. And what does that mean, and how does that apply to what we're talking about here today?
So this is an acronym in the medical community that really is focused on how to overcome issues with medication adherence. So basically, it's all based on communication. The S in SIMPLE just stands for simplify the patient's regimen. So if we can move you from a medication twice a day to once a day, or if we can combine 2 medications into 1 tablet, or adjust the timing of things to make things easier for the patient, then that's always encouraged. The I is for impart knowledge, which basically means that we really want to focus on the patient and the provider having shared decision making, meaning we talk through things and we agree on a treatment plan before we just, go wild writing prescriptions. We also want to make sure that we give them really clear instructions. So I always try to give verbal instructions with a medication if it's new to the patient in the office, but then when they check out, they also get written instructions. The M is for modify the patient's beliefs or the behavior. So really, I want to understand why a patient is reluctant to take a medication. And I also want the patient to understand what the risks of not taking this medication are. The P is for providing communication and trust, which we have already talked about, really important between a provider and a patient, for both of us, really, in our relationship. So, your provider really should be actively listening to you and giving you emotional support when you're talking to each other. The L is for leave the bias, and this is really directed at providers rather than patients. But we want to make sure that we're really talking to patients on a level that they can understand.
That helps.
Yeah. Absolutely. And, in different communities, there's different biases. And we want to make sure that we are absolutely not engaging in any of those, that we're treating patients equally and meeting them on the level that they're at so that they can understand and we can understand the treatment plan. And then the E in simple is for evaluate adherence. Always want to encourage patients to self-report, meaning if they've stopped taking a medication, please tell us and tell us why. Every time you come in, your provider should be asking about whether or not you're taking your medication as prescribed. We actually encourage patients to bring their medications to every visit so that you're
really?
Yeah. And we give out bags that patients can keep their medications in so that every time they come in, I'll look at their different medication bottles, see if they're due for refills, and just make sure that patients have all of the resources that they need to be adherent.
This has been really interesting to listen to you.
Oh, really?
Your knowledge, your dedication of what you do. And I have to ask you in closing, you've worked in 4 different hospital systems, I think. Mm-hmm. 3 or 4 at least. Okay. Define what you see here at CenterWell and how you feel about what you're doing now versus what it was like in these other models, based on the resources and time and all the rest of it you have.
I've never been happier at a job than I am now. I think when I was being recruited for this job, one of the things they told me is that providers here always say, this is how primary care should be practiced. And I have found that to be completely true at CenterWell. As a provider, it's a stressful job. Anybody in healthcare, it's a stressful job. It can be a thankless job. And there's been a lot of healthcare worker burnout, especially since the COVID pandemic. Lots of people have left the bedside, nurses, doctors, respiratory therapists, physical therapists. So there's really a shortage in everything. And I feel like when you're allowed to practice in this way, it is so much more rewarding to get to have a true relationship with a patient, to be able to feel like you're being thorough and you're really, really taking care of them in the way that you want to.
If that doesn't sum it up, I don't know what does. Okay, I think she just did an excellent job. You want to learn more about it? It's seniorfocuskansascity.com, seniorfocuskansascity.com. And now I leave you with this thought from Dr. Martin Luther King. Americans must learn to live together as brothers and sisters, or we will surely perish together as fools. Truer words were never spoken. Thank you for listening to America's Healthcare Advocate, broadcasting coast to coast across the USA here on the HIA Radio Network. Goodbye, America.